Get to know Pemiscot Memorial Health Systems in Hayti, Missouri. Pemiscot Memorial Health System is committed to provide an organized system of healthcare services to all persons within our service area without regard to age, sex, race, color, national origin, creed, financial status, physical or mental challenge. Pemiscot Memorial Health System strives to work in collaboration with local, state, and federal organizations to ensure access to primary care for all residents with a special emphasis on preventative health and wellness. We diligently work to maintain our financial strength in order to remain a prominent provider of medical services for the region. Our highly skilled team of healthcare professionals are dedicated to providing you and your family with the best quality care. What follows is an educational video to inform Pemiscot County about Pemiscot Memorial Health Systems. These new changes address the community's needs by providing new areas of services and specialties. Pemiscot Memorial Health Systems is committed to improving the health of individuals and the overall health of the community. This involves collaborating with community partners to understand the community's needs and strengths and ensure that services are patient-centered and accessible for the community at large to achieve positive health outcomes. This video will cover the hospital's background, new changes, new services and specialties, new MRI machine, urgent care, qualified physicians and their area of practice, and our patient testimonials. Pemiscot Memorial Health System started in April of 1951. Currently, we have a 24-hour emergency room, 12-hour convenient care clinic, a licensed 49-bed acute care unit, 52-bed psychiatric inpatient Medicare certified unit, a long-term care facility, 6 rural health clinics. We have a variety of exciting new changes. We have new physicians, new family practice locations, and new specialties like internal medicine and pediatrics. Pemiscot County is offering new and emerging services to improve the health of the community. Residents have fewer number of mental health providers, primary care physicians, and dentists compared to the state of Missouri and top U.S. performers. 6 Medicare, Medicaid certified rural healthcare clinics, a diagnostic center, and a variety of services are available in numerous locations throughout the Missouri Boot Hill. Availability of primary care physicians and dentists is essential for individuals to receive preventative care and referrals to appropriate specialty care. Life expectancy in Pemiscot County is 70.7 years, which is below 77.4 years for Missouri and top U.S. performers, 81 years. Dr. Kolpeksa states that life expectancy is on the rise in Pemiscot County due to increased accessibility to healthcare and better control of chronic conditions. Pemiscot Memorial Health Systems is actively expanding services and specialties to address community healthcare needs. What's new at Pemiscot Memorial Health Systems? Pain management is a critical component of overall health and physical well-being. Many sources of pain can be determined and treated now at Pemiscot Memorial Health Services. Podiatric medicine services with an on-location physician and surgeon who treats foot, ankle, and related structures of the leg. Psychiatry services, focusing on the diagnosis, treatment, and prevention of mental, emotional, and behavioral disorders. Urology, focusing on surgical and medical diseases of the male and female urinary tract system and male reproductive organs.
Physical therapy is the medical discipline that concentrates on improving the quality of life through prescribed exercise, hands-on care, and patient education. Occupational therapy is a branch of healthcare that helps people of all ages who have physical, sensory, or cognitive problems. Speech therapy is the assessment and treatment of communication problems and speech disorders. And wound care for safe and effective management of wounds, cuts, skin irritations, and more. We offer both inpatient and outpatient care for a variety of therapeutic services. Inpatient services are administered during a stay in a hospital. Outpatient services are what you receive when you are not admitted to the hospital.
We now have magnetic resonance imaging, MRI. Uses a large magnet and radio waves to look at organs and structures inside your body. We can now scan to diagnose a variety of conditions, from torn ligaments to tumors. Convenient care in Hayti, Missouri. Open 7 days a week. From sprained ankles to coughs that just won't go away. Our providers treat a variety of conditions in a comfortable environment. From general dentistry, podiatry, emergency medicine, and psychology, we offer a wide range of services for the community. Quality long-term care services to help people live as independently and as safely as possible when they can no longer perform everyday activities on their own. We have added new physicians, new family practice providers, new internal medicine and pediatrics specialists.
Basically retired from family medicine after 25 years, and I had a friend, Dr. Steve Pooh in Kennett, Missouri, who was doing wound care. So he talked to me about potentially doing some training with him, so I went and did the course and then proctored under him for about 6 months. And then started filling in for him in Kennett, Missouri, and then took over the wound care center in Poplar Bluff, Missouri. Well, we see a lot of diabetic foot ulcers, venous leg ulcers, arterial ulcers, post-surgical wounds, some acute wounds and burns, so just a whole variety. Well, initially they come in and we do a full assessment, and then we'll take a look at the wound and determine where we think its etiology is. And then it's a series of sometimes having to clean the wounds up weekly, it's called debridement, get a fresh wound base and convert it from a chronic senile wound into an active wound again so that it can heal.
When you can make the biggest impression on a patient and let them know what you are about, what you stand for, and that is trying to set them at ease that you will listen to them, you will take what they have in their complaints seriously, and that you'll do everything you can to satisfy any condition they have. Or they'll come to me as their primary care doctor and say, what does this surgery entail? Well, I'll explain the surgery the best I can, and I refer any other surgical questions to the surgeon, but I try to set them at ease. Over the years, I've been practiced for about 25 years, so the most rewarding thing to me is the people that have come back to me because they said they trusted me, and that means that means the world to me, that they trust me and they come back because they know that I will give them good care.
Dr. Pemiscot is a wonderful doctor, and we are very happy to have him on staff. He has been our family doctor for years. He took care of my husband before he died, and he has taken care of all of my family. We trust him. He always has time for us. He always works us in when we're sick. It's none of this, I'll see you next month, or anything like that. He's just wonderful. He's caring. He listens to you. He examines you. He does the test, but he examines you also. When my husband was dying, Dr. Pemiscot, I called him. He had given me his personal number so I could contact him, and I was very upset. And he came over to the nursing home where my husband was, and he sat down, and he gave my husband something to calm him down and asked me if I needed anything to calm me down, and he stayed with me for a couple of hours. And I so appreciated that. I really needed that at that time. And if you're looking for a family doctor, Dr. Pemiscot would be an excellent choice.
From the age of 5, I wanted to be a doctor. I really couldn't tell you why. I was just fascinated with medicine, and I loved my doctor's visits, and from day one I wanted to be a doctor, and my grandpa always told me girls couldn't be doctors. And I think that always kind of pushed me a little further, and I never even considered another profession. And sometimes I think, this is exactly where I'm supposed to be. I love my patients. I love serving in underserved communities where I know that patients need physicians, and they just need people that care. They need to know they can count on somebody. I have a lot of complete families where I see their aunts and uncles and grandmas and grandpas and brothers and sisters, and that really helps the medical care as well, because you do see the family history, and it's easier to diagnose sometimes whenever you're watching the entire family.
Dr. Erica, is a real fine doctor, I think. From a 1 to 10, I think she's about 11. And I've been real sick. I'm 85, and she takes care of me. And back in November, I had number 3 heart attack, and she saved my life. And so I've been coming to her for about 3 or 4 years. I think she's a wonderful doctor. And the office is nice too. It's always clean, neat. And the girls at the office are always nice when I call them and need something.
Education is always the key. You have to make sure that they understand the risks of anything that you're doing, but also the benefits, what you expect to happen, and of course there's always a wide range of things that can happen. I try to take a lot of time with my patients, and I don't try to overbook for that reason, but if you have a question, I want you to know all the answers. I talk a lot, and so I'm not one of those doctors that just sort of like you come to see me and I'm not going to explain to me. If you have a question, I will do my best to answer it for you. It's sort of amazing because I'll have people that'll come see me sometimes and they'll say my foot hurts, and I will tell them, explain to them, your foot is always going to hurt. You are never going to get better. And they'll smile at me, and it always sort of, it catches me off guard because basically I told you, you're never going to get better. But they have an answer, and sometimes that's what you want. You're not always going to get better, but you want an answer, and you want someone to take the time to explain to you why it is you hurt, empathize with you a little bit, but then also explain to you like, hey, this is what you can expect from now on. And so even if you tell something horrible, like I'm going to have to cut your toe off or you're going to lose your foot, at least they know, and not knowing is sometimes more scary than knowing.
Our convenient care clinic is open 8 a.m. to 8 p.m. and has weekend hours. You can walk right in and receive prompt medical attention with minimal wait times, affordable service, and ultimate flexibility. Our convenient care is a smart, sensible choice for your healthcare needs. We provide a variety of screenings like flu shots, vaccinations, on-site x-rays, eye exams, blood tests, and urine pregnancy testing. We invite you to come to experience our new, expanded healthcare services. Pemiscot Memorial Health System is growing with the community and beyond.